Hi everyone, my name is Lauren Sullivan and I am presenting my key assessment for APN605 Nutrition Through the Life Cycle. The case study that I'm presenting today is Jane, a 14-year-old teenage female. Jane was referred for nutrition counseling following her well visit with her primary care physician. Jane presented at that appointment weighing about 153 pounds at 62 inches tall. Her calculated body mass index is 28 kilograms over meters squared. She has significant weight history, including a 10 to 15 pound weight gain each year for the last 6 years. So what is a healthy weight for Jane based off of her height? A look at the growth charts for this patient might be telling. The red circle shows Jane's current weight plotted above the 95th percentile, which defines obesity in adolescence. A body mass index that falls between the 85th and 95th percentile would be considered overweight. A body mass index of less than the 85th percentile would be the goal. For Jane, we are looking at a goal weight loss of about 20 to 25 pounds to 130 pounds. This is plotted as the blue circle and brings the BMI for age to less than the 85th percentile. A nutrition assessment wouldn't be complete without assessing other information as well. Other assessment information may include social and financial factors, family dynamics, and family history. In Jane's case, her blood pressure of 125 over 82 is actually expected based off of age, gender, and BMI for age. The threshold is 130 over 85, and this information was obtained from the National Institutes of Health 2005 fourth report on hypertension control in children and adolescents. The social factors that are significant in this case include the fact that she has 2 siblings living at home with her and her parents. They're aged 8 and 4. There's limited family finances. English is the primary language, and Jane has been identified to be reading at the 4th grade level. The family history is also very important because the mother and the father both struggle with obesity. The mother also has hyperlipidemia, and the father has type 2 diabetes. Labs were also obtained at the primary care physician's visit. The borderline labs are highlighted in yellow, and the abnormal labs are highlighted in red. On this slide, the high fasting blood glucose labs may lead to insulin resistance. It may mean the presence of polycystic ovary syndrome or prediabetes. Jane is at high risk for type 2 diabetes mellitus. Her low HDL level, which is high density lipoprotein, may indicate that she's not getting in enough exercise. The high LDL level is likely associated with high sugar intake, high saturated fat intake, and excess consumption of fat overall. Jane brought a 3-day food diary to the nutrition appointments for part of the nutrition evaluation. The food diary revealed that Jane eats few home-cooked meals. Actually, her family dines out frequently on fast food. Her daily fluid consumption includes sugar-laden soft drinks and juice. Jane reports participating in the school lunch program. With a high intake of sugared desserts and salty snacks, Jane's diet lacks sufficient intake of fruit and vegetables and, of course, fiber, and also water. Assessing all of that information, the diet was put into a chronometer to have an evaluation of the macro and micronutrients. It revealed that Jane takes in 3 times the recommended amount of sodium in the course of one day. It is also clear that Jane consumes excess sodium, excess fat, and sugar on a daily basis. Her dietary patterns are placing her at risk for cardiac-related illnesses, hypertension, and diabetes. It's interesting to note that Jane was consuming greater than 500 calories a day from sugar-laden beverages and over 1,000 calories per day above her recommended needs. The micronutrient distribution looked a little bit like this. There was insufficient intake of calcium and vitamin D, insufficient intake of potassium and magnesium, and insufficient intake of zinc and folate. The minerals, being in low levels, are likely related to the lack of sufficient fruit and vegetables and even dairy products in the course of the calcium and the vitamin D insufficiency. The concern for me with her is that she's still in bone development, and that could later lead to osteopenia and osteoporosis as an adult. I felt like the DASH diet was the best way to intervene in this patient. It will address hypercholesterolemia, it can address diabetes and hypertension in adolescents, and it would include weight loss through exercise and dietary changes. These things include reducing the overall sodium intake, limiting dietary fat to 30% of the total calories, using only low-fat dairy and dairy substitute products, limiting fast food intake, participating in family meals and consuming breakfast, limiting juice to 4 to 6 ounces per day, and also increasing fiber. The cardiovascular health integrated lifestyle diet, also known as Child 1, the DASH diet, which stands for Dietary Approaches to Stop Hypertension, and MyPlate guidelines all support these changes. For goals for Jane, we decided to focus on making sure that she had enough to drink, so 10 cups of water per day, avoiding juice and soda, also aiming for sufficient exercise, and we set that goal at 60 active minutes per day. Following an 1,800 calorie sample meal plan, which was provided to her, eating breakfast daily, vegetables and fruits at almost every meal, and using school breakfast and lunch to make sure that she's eating consistent meals throughout the day. The recommendation was also to help with family meals and eating dinner with her family. And her job would be in the food preparation and also to maybe help cutting foods or planning menus. Jane also needs a vitamin D supplement, and that's because her intake is insufficient. The goals for Jane's family is important too because they're integral in helping her make decisions. So we've asked Jane's family to reduce dining out to 1 time a week or less. It'll also be a cost reduction for the family, and they're already having some financial issues. I also encourage the family to apply for WIC, SNAP, and local food bank services due to financial constraints. I also requested them to prepare meals as a family and eat meals as a family. There are many cooking classes associated with churches and community centers and local colleges that the family might benefit from. The last goal was to consult with a physician about what is a safe level of exercise for both the parents and the children in the family, since they're already struggling with obesity. 3 referrals would be pertinent in this case. The first one would be for an adolescent weight management program to supervise Jane's progress. The second one would be to a pediatric exercise physiologist, and that is in order to help her establish what's an appropriate exercise routine for her. The third referral would be to a pediatric behavioral specialist that might give her insight into mindful eating techniques. This is a 3-day meal plan that we generated together after we took Jane's likes and dislikes and made a list of foods she liked. We came up with a 3-day pattern of eating that follows the DASH diet and also follows the MyPlate recommendations for food portioning. You'll note that there's plenty of fresh vegetables and fruits. You'll notice that there's a lot of whole grains and carbohydrates that are low in sugar, so that this can help provide Jane with the energy that she needs without saturating her diet with fat and sugar. The handout that was developed to help her understand these changes and to help her make good choices beyond the meal plan is to celebrate the dash to health. And I took that from the DASH diet, so we're going to dash to health in a couple different ways. The goals are to make sure that anything that has a star by it is recognized as an important goal. The first one is dash to good health. And the dash to good health is encompassing everything. The second star is to drink 8 to 10 cups of fluid every single day, and that should be coming from water. So instead of drinking juice and fruit punch and lemonade and soda, Jane should try to drink water and maybe light juices, sugar-free popsicles, maybe sugar-free Jell-O. She has an affinity to eat those donuts at the bottom, so we want to keep away from those and maybe focus on things like sorbet and fruit and other healthful desserts. The next area is dash to less salt. In this area, we're trying to help Jane reduce overall sodium. Using lean meats, using salmon, fish, herbs and spices, unsalted snacks, instead of fast food, instead of bacon, instead of sausage and gravy and salt shaking and chips and other salty snacks. The fourth area is what we had already talked about, and that was the dash to dinner, and that talks about eating dinner as a family. I found it very interesting that literature actually supports that if you eat together as a family, there's more propensity to avoid obesity. The next area is a dash to fitness, and in this area, we're looking for 60 active minutes per day. And if she's not able to accomplish that all in one setting, it would be perfectly acceptable to break that out into 20 minutes 3 times per day. The next area is to dash to the 1800 calorie meal plan. And so this goes well beyond the 3-day recommendations that we had done in the meal plan. We want to make sure that Jane has the opportunity every single day to choose 4 to 5 portions of vegetables, 4 to 5 portions of fruits, and 6 portions of whole grains. And the colorful illustrations will help her choose the foods that she likes and in a very appealing manner. Included in this 1800 calorie dash meal plan would be eating dairy products 2 to 3 portions per day or dairy substitute, eating 6 portions of lean fish and meats and other protein-based foods, and eating 2 to 3 portions a day of fats and oils. This meal planning worksheet can be used for other calorie goals as well if you have another client who needs a different calorie level. The last star is to dash to the 1800 calorie meal plan by choosing weekly 4 portions of nuts and legumes and 4 portions total of those saturated sweets. And that means limiting perhaps jelly on toast to a teaspoon at a time instead of the large amounts of sugar that she's getting in her meal plan. I believe this was an extremely relevant case study. We're seeing the incidence of childhood obesity escalating, and I believe that we have to be equipped as nutrition professionals to help deal with the obesity epidemic. Have a wonderful day.